Sepsis is a syndrome that people develop who have infections, where the body reacts with great inflammation to create an illness that's worse than just the baseline infection that patients have. And the patients end up suffering organ damage. It's clearly the #1 killer of inpatients in the United States. In Sutter Health, some of our data suggests that 11% of our hospitalized patients have some form of sepsis, but that of the patients who die in our hospitals, 48% of them die of some form of sepsis. And you can imagine if you want to tackle mortality as a problem in hospitals, this is a great place to start.
It was a really unique opportunity for people who come from the biggest hospitals in our system and then the smallest hospitals in our system.
That included hospitalist teams, intensive care unit teams, emergency departments, pharmacists, electronic health record experts, and a number of other colleagues.
What we tried to do was create protocols that could be standardized across the Sutter facilities.
Looking at a patient with a much more critical eye from the little bit of data we have at the time of triage.
One of the things that truly impacts the care of sepsis patients is the first 6 hours really matter. Our effort was to standardize all of those 6-hour strategies into discrete packets of work, whether you're in the emergency department, the medical surgical floor, or the ICU.
The nurses now have tools within the electronic health record system that prompts them to screen the patient for sepsis, and if they do screen that they do have sepsis, to then trigger actions.
Sepsis alert, room 3. Sepsis alert.
Let's get the people to them. Let's get the tests that we need, get the antibiotics started, and really take care of that patient in a very short window of time.
The physicians on their end, they now get prompted to use order sets that are incorporating the best practices that are known internationally.
Once we got the standard work created, we then brought it to our local site at Eden Medical Center. We provided education, and we saw an effect.
A few hours after I took the class, I had a patient. He was ready for discharge, and then all of a sudden, he's like really, really cold. So I took his temperature, and it was 101. And I knew from the training that increase in a temperature that rapidly, we better look at something else. And it turns out he did have sepsis. It happens so fast, you have the tools to actually save people's lives.
Sepsis alert, room 4101.
And I really feel that we saved his life.
The work at Eden has happened progressively since August of 2014 when the pilot went live, and their mortality has declined steadily since the pilot began.
Partnership and collaboration have been absolutely vital to the success of our sepsis program.
This is the first time we've tried to standardize care for complex disease at all of our affiliates in a fashion that's reliable. And nationally, this will be a model for other healthcare systems.